Welcome to the beautiful world of breastfeeding. Embarking on this journey is a deeply personal and rewarding experience. It's about nourishing your baby with the perfect food while forging an unbreakable bond. This guide will equip you with the knowledge and confidence to breastfeed successfully. We'll cover everything from the remarkable benefits to practical tips for overcoming challenges. Breastfeeding is a natural extension of pregnancy and childbirth. It's a learned skill that may take time and patience. Rest assured, with the right information and support, you can provide your baby with the best possible start in life. We'll explore the amazing properties of breast milk and how it changes to meet your baby's needs. This journey is about so much more than just providing food. It's about nurturing, comfort, and connection. The closeness you'll experience during breastfeeding fosters a deep sense of love and security for both you and your baby. We'll delve into the emotional aspects of breastfeeding and how it strengthens the mother-baby bond. As you embark on this incredible journey, remember that you are not alone. Millions of mothers have successfully breastfed before you, and countless resources are available to support you. Let's begin with understanding the amazing benefits breastfeeding offers to both you and your little one. Breast milk is nature's perfect gift, a tailor-made superfood for your baby's growth and development. Packed with antibodies, vitamins, and nutrients, it provides unparalleled protection against illness and disease. From the first golden drops of colostrum, rich in immune factors, to mature milk that evolves with your baby's changing needs, breast milk is a dynamic and living substance. For your baby, breastfeeding offers a reduced risk of ear infections, respiratory illnesses, allergies, and digestive problems. It also lowers the chances of developing chronic conditions later in life, such as obesity, diabetes, and certain cancers. The unique components of breast milk contribute to healthy brain development, promoting optimal cognitive function and a strong foundation for learning. The benefits extend far beyond your precious little one. For mothers, breastfeeding releases hormones that promote faster postpartum recovery, reducing the risk of postpartum hemorrhage and aiding in uterine contraction. It also lowers the risk of developing breast and ovarian cancers, osteoporosis, and cardiovascular disease. Breastfeeding can be an empowering experience, boosting confidence and fostering a sense of accomplishment. Beyond the physical benefits, breastfeeding nurtures a deep emotional connection between mother and baby. The skin-to-skin contact releases oxytocin, the love hormone, which promotes feelings of calmness, bonding, and well-being for both of you. The act of breastfeeding itself provides comfort and security for your baby, establishing a foundation of trust and love. The World Health Organization and the American Academy of Pediatrics recommend initiating breastfeeding within the first hour of birth. This early contact is crucial for establishing a good milk supply and fostering a strong breastfeeding relationship. Skin-to-skin contact immediately after birth helps regulate your baby's temperature, heart rate, and blood sugar, while also encouraging them to seek out the breast. Don't be discouraged if breastfeeding doesn't come easily at first. It's a learned skill, and both you and your baby are new to this. Be patient, seek support from hospital staff, and trust your instincts. Remember, every drop counts, especially in the early days when your baby is receiving colostrum, the antibody-rich first milk. Frequent feedings are essential for establishing and maintaining a good milk supply. Newborns need to feed 8 to 12 times in a 24-hour period, and it's important to follow your baby's cues for hunger rather than a strict schedule. Look for signs like rooting, sucking on hands, and bringing their hands to their mouth. Remember, breastfeeding shouldn't be painful. If you experience any pain or discomfort, seek help from a lactation consultant or healthcare provider. They can assess your baby's latch and offer guidance on positioning and technique to ensure a comfortable and successful breastfeeding experience. Comfortable positioning and a deep latch are essential for effective breastfeeding and preventing nipple soreness. Experiment with different positions to find what works best for you and your baby. Some common breastfeeding positions include the cradle hold, cross cradle hold, football hold, and side-lying position. To achieve a good latch, bring your baby to your breast, not your breast to your baby. Support your breast with your hand, forming a C shape with your thumb and fingers. Gently tickle your baby's lips with your nipple to encourage them to open their mouth wide. When your baby opens wide like a yawn, quickly bring them to your breast, aiming your nipple towards the roof of their mouth. A good latch should feel comfortable and pain-free. Your baby's lips should be flanged outward, covering a large portion of the areola, not just the nipple. You should see a rhythmic sucking and swallowing pattern, with occasional pauses for rest. If you experience pain, gently break the latch by inserting your finger into the corner of your baby's mouth and try again. Remember, practice makes perfect. Don't be afraid to ask for help from a lactation consultant or healthcare provider if you're having trouble with positioning or latch. They can provide personalized guidance and support to ensure a positive breastfeeding experience for both you and your baby. All right, let's dive into some solutions to common breastfeeding challenges. First, if you're experiencing sore nipples, try adjusting your baby's latch. Make sure your baby's mouth covers more of the areola. If you're dealing with low milk supply, consider increasing the frequency of feedings and ensure you're staying hydrated and well-nourished. Engorgement can be relieved by nursing frequently or using a warm compress before feeding. Remember, it's okay to seek help from a lactation consultant if you need it. Breastfeeding can sometimes be more challenging in unique situations. For example, if you have multiples, try tandem feeding or alternating breasts to ensure each baby gets enough milk. If you're returning to work, pumping and storing breast milk can help maintain your supply and ensure your baby continues to receive the benefits of breastfeeding. For mothers with medical conditions, always consult with your healthcare provider to tailor a breastfeeding plan that works best for you and your baby. Now let's talk about recommendations and support for your breastfeeding journey. Surround yourself with a supportive community, whether it's family, friends, or a local breastfeeding support group. Don't be afraid to ask for help when you need it. Utilize resources like lactation consultants and breastfeeding hotlines. Remember, every breastfeeding journey is unique, and it's important to find what works best for you and your baby. In conclusion, breastfeeding can be a rewarding but sometimes challenging experience. Don't hesitate to seek out resources and support to help you along the way. If you have any questions or need further assistance, reach out to your healthcare provider or a lactation consultant. Thank you for joining us, and we wish you all the best on your breastfeeding journey. Stay connected with us for more tips and support.